How about behind in a calf? You know, a calf or major muscle groups like your thighs or anything like that. Or anything there?
Calves, like just a little touch of them.
She doesn't have any major muscle groups left.
Right.
She's all skin and bones. You're a very well dressed skeleton, Mom.
Yeah, yeah. Yeah, they dress me. He was throwing shit last week.
Really?
Yeah.
I miss all the good stuff when I don't come to antibodies. People have allergic reactions and...
Oh yeah, you were there for that, were you?
Nope.
You had front row seat for it. It's kind of scary. Yeah, no, it was Mr. Butterfingers last week. Twin for dinner, right?
Your head still hurt, Mom?
Huh?
Do you still have a headache?
I'll tell you when to bring it in here. Deep breath. Just keep deep breaths.
Is it really sensitive today?
Hurt a little bit today.
Not too far.
If you can, you know, if it gets to the point where it's not, it's too painful, you know, there's just, like I said, there's lidocaine creams and stuff like that you can
You
get.
tell me back.
Oh,
Holy crap, it's like a bed and shit.
Yeah.
One, two,
Is that comfortable?
Not really.
What's wrong? You were crying earlier. Is it your head?
I'll be okay when we get some time. But I want to take my fucking pain. Got nauseous this morning. I had to take a nauseous pill.
You couldn't take your pain pill? Or you did take one?
Took a nauseous pill because I had nauseous like for the first time. It's like, oh my god, what's the fuck?
Okay, how are you doing?
Is it as bad as it was the other day?
Sort of. It's like, just keeps my thumb.
Yeah, you have arthritis too.
Seriously?
Just kind of wiggle it. Wiggle, 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 wiggle. What are you rubbing on? Alka-Seltzer.
Yeah, buddy.
Enjoy that. Hey, so today's a big day. Found out the results of the CAT scan. Mom's already here. I'm gonna try and bring you guys with us. Don't really know how our doctor feels about that. But yeah, so I'm gonna try to bring you guys, and we're hoping for good news, good news, good news, good news. So yeah, that's all.
Body is going down.
Oh, Deshaun, the RM that I give.
Oh, Deshaun. Okay,
Yeah.
I know him. Yeah, he's a nice
Yeah.
guy. Okay, so he said, why? Just by looking at you, he said
Right,
your
'cause
body is
he-
going down.
He knows. He knows when I'm usually bubbly on Wednesday when I go.
Okay.
home.
So you're not having a good day that day, huh?
No.
Your blood counts are good today.
Yeah, I know. Seriously, thank God.
White counts, red cells, platelets are all good.
Are her potassium levels good?
I don't have the potassium yet.
Oh, okay.
So we're gonna take few hours. And potassium was July 16th was good.
Right.
2 days ago was fine. And
Same
before that,
for me.
always runs low. You're taking potassium right now?
No.
Diarrhea?
No. It's just my protein shakes and it's got potassium.
Okay.
Yeah, because I'm done with my 3 pills that you told me to take. I also need something to state why I need a wheelchair for Medicaid. And I stopped smoking last week too.
You stopped smoking, good for you.
Yes.
So you had 2 treatments since I saw you?
Yeah.
Okay. When is your next treatment due? Next week sometime?
20
Next Wednesday.
Wednesday.
Every Wednesday.
Every antibiotics.
Next coming Wednesday, okay.
Yeah, antibiotics is next week.
Your weight has been the same.
But I had to force myself to eat last week. Because I mean, my body's just.
You were 115, 109, 108. No, you did lose some weight,
Right.
few pounds, 3 pounds. And
Right, like a champ yesterday, though.
your last CMP was 126. Enzymes are okay.
What's it look like?
So in the lungs, they're saying that of course you have a severe emphysema,
Right.
and they're seeing some spots in your lungs, very small, okay, like a tiny, like 8 mm spots, and on both lungs, and you don't know what it is, and the radiologists don't know what it is, but they're very small. It's hard to say, and there are a few of them like 5 mm, 6 mm, some 7 mm, like tiny spots, and
Maybe that'll go away now.
so they were saying that it's hard to say that it's a cancer because you had a CAT scan before that.
Yeah. In March.
March, so it's such a short time period.
Right.
So it is a cancer, or you could have some pneumonia, or could have been some infection, some inflammation. Because they're too small to say anything. We cannot stick a needle in to get a
Right,
biopsy,
right.
and we cannot get a PET scan to confirm these
Right.
lesions are malignant or not. Your CT of your abdomen, so you have some surgical changes,
Right.
ileostomy, and the implants in the abdomen actually looks better than March CAT scan. That's a good thing.
That's good.
The peritoneal tumor implants are much improved since March. There is still a mass on the right lower quadrant, but they're not sure this is really a mass or it's like a surgical changes,
Right.
because your original tumor was removed,
Right.
or some remnant of the ovary.
Yeah, probably. Remnant of the ovary.
There is a spot on the liver, they're not sure exactly what it is. and there's a left adrenal lesions, 13 millimeter. There's not change. So the more visual disease also in the peritoneum,
Right.
that looks better. Okay.
Sweet.
Then we have this small, tiny stuff here and there. We
Right.
don't know what they are. Okay, and but there's no obvious cancer which is growing anywhere. Okay. So that's a good thing, at least. But I'm concerned about your weight loss. Why are you losing weight?
Because I had to force myself to eat last week because of my antibodies. It just messed
Antibody?
with me. Yeah, my antibodies just messed with me last week and I couldn't eat nothing.
Or the treatment?
Yeah.
Or the treatment
Yeah.
messed with you, okay.
Yeah, it's like, oh my gosh. I mean, I had to force myself to eat.
Get some Ensure or Boost or something.
Yeah,
She has it.
She hasn't, just start
Right.
doing that 1 or 2 a day.
okay. The protein
Can you give her
shakes.
like THC pills?
They're very expensive. I can write it down. It's called Marinol, okay, and
Oh, the insurance covered though.
that works for the nausea and as well as for appetite. How's your numbness?
Guarantee it'll be a hell of a lot cheaper than weed brownies.
Right.
Hey, so basically her original tumor is in check, so they're taking her off 2 of the chemo meds, 2 of the worst ones. I'm waiting for the pharmacy to open so I can go get her her pot pills so she can eat. Yeah, doing good. Excited she doesn't have to have the pump anymore, which is really cool. She's just on 2 or 3 now. I can't remember. She's on so many goddamn medicines, but she's doing better. She's feeling kind of crappy from the chemo. She gets dizzy a lot and gets sick a lot, but other than that, it's going pretty good. Just hanging out. Birthday's coming up, so I invited some of you guys, mostly just the people that came to, you know, the last thing that I did. I don't want to waste time inviting people that don't care. So yeah, that's it. Bye.